Hello and welcome to the eClaims webinar. My name is Mary Claire. I work in marketing for the eClaims service and I'm excited to be here today for this discussion on eClaims. We did a survey last year with Canadian consumers to gauge their interest in direct billing services like eClaims. And we found that 80% of privately insured Canadians agree that direct billing will improve their experience when visiting their healthcare provider. Nearly half of them would consider changing healthcare providers to benefit from direct billing. And 3 in 4 are likely to inquire about the direct billing service the next time that they visit an extended healthcare professional. So we're here today with you to talk about how you can offer eClaims to increase client satisfaction and retention with your existing client base and new ones. With me today is my colleague Michelle, our eClaims account executive. Michelle will be going through the benefits and particularities of eClaims, and he'll be doing a quick demo of the service so you can see how it works. And after that, I'll go through a few of the benefits that we can offer you from a marketing standpoint when you sign up for eClaims. So now I'll pass over the mic to Michelle.
Thank you, Mary Claire, and welcome to eClaims. So, what is eClaims? eClaims is a direct billing service that enables healthcare professionals such as you to submit claims to the insurer on behalf of your patient. It's a direct billing tool. eClaim works exactly as when you go to the pharmacy and give your prescription to the pharmacist, and he gets back to you, and you only need to pay the out-of-pocket difference not covered in your insurance plan. eClaim is connected and used by many insurers across Canada. 85% of all privately insured Canadians can benefit from over 17 different insurers. And we keep growing. To keep track, please visit our website to find out more who are the insurer on board today. Why use eClaim? eClaim offers professional many advantages. First, cost saving, more business, free marketing, and delighted patient. Let's begin with cost saving. Cost saving in terms of reduced debit and credit card fees. As an entrepreneur, you're paying credit card fees for every transaction. It's a fact that we're in a day and age that everybody's paying with their credit cards. As an entrepreneur, you're paying 2.5%. Say that at my service, I would charge $85. My patient pays with its credit card. 2.5% out of $85 is $2.13. Let's say I'm using eClaims for that same patient, and that patient is covered, and I will be getting from the insurer directly paid into my account $74, and all that's left for me is to charge the out-of-pocket difference not covered, which is $11. Well, 2.5% of $11 is 28 cents. Now, picture this. If you're only doing 3 eClaims a day, that would be saving up to $2,000. Let's say you're doing 50 claims a day. Because you're a banner chain of clinic with multiple locations, well, that would be over $38,000 worth of saving in credit card fee yearly. Direct billing will give your patient another reason to recommend your service and come back to you. Again, we're in a day and age that most people are using social media. They will likely promote you somehow. They like their service, they like your location, and they like your fee. But also, you can encourage them to mention that if they're going to do this, that you offer direct billing services as an added value. We have a search tool that has been visited over 40,000 times in 2018. Patients are looking for a healthcare provider that is offering direct billing. That's where they would find it. Delighted patient? Well, I think it's obvious that it increases your patient satisfaction and loyalty. Recent study in a white paper shown that professionals offering eClaim are getting more follow-up appointments by 9%. Well, that makes for faster and better health recovery for your patients. And it's completely free for you and your patient. So, who pays for it? Well, it's very simple. It is covered in your patient's plan. How does it work? eClaim is simple to use. No hardware or software is required. eClaims work with most web browsers. All you need is an internet connection. Claims are processed in real time. You will receive an insurer response within seconds, allowing you, when client-facing, provide the response back to give details on the amount that needs to be paid out of pocket. Many patients do not know their plan coverage, so you can predetermine to see if they are. All you need to do is on the portal, go and select predetermination and see if they are covered for your services. If they are, you can simply switch that predetermination into a direct billing claim and get paid directly into your bank account. Ensure refund your services quickly into direct deposit, no more having to handle checks. Very simple. Also worth noting, it's available through many leading practice management software solutions. And we keep growing. To keep track, please visit our website to find out who are the software vendors available today. Note that a fee may apply to use eClaim through a practice management software. We also have a eClaim app. So for those provider on the go, eClaim at your fingertip. At TELUS, security and privacy is at the forefront of everything we do. Hence why we adhere to all provincial and federal regulation as it relates to privacy and protection of personal data, such as PIPEDA. So in a few seconds, I'm going to log into our web portal to show how to process a claim. If ever you're wondering if you are eligible, visit our website at telushealth.co/eClaims to get all of the details. It takes only a few seconds to verify, and it's totally free. Without any further ado, let's log into our webpage and see how to process an eClaim. So once you've registered and you've received your username and password, you would just need to log in on the internet, go on the secure website, and enter your username and password. You would be prompted with legal information concerning PIPEDA, which I just mentioned a few seconds ago. And then you are on the home screen. On the home screen, very simple, you have three options. Home, in the green banner on top, eClaim to process an eClaim, or contact us. Yes, we do not hide away. If you need to reach us, you simply click on contact us, and you can either fill up the form, or we have provided also a phone number that is available for you. Let's go back on home. You can edit all your profile information there if you need to, but what we want to do today is process an eClaim. So I'll just click on eClaims. On the eClaims page, before I go and submit an eClaim, I can reference to some material. So we have fact, startup guide, user guide, toolkits, and you can download additional material to promote eClaim. Mary Claire is going to elaborate on that in a few minutes. So let's click on Submit an eClaim. eClaim is very simple. It's in 3 steps. So the first thing we need to do is identify ourselves and our patient. I'm going to select the insurance company covered by our patient. You can see there's many of them right there on screen. I'm going to, for the purpose of the demo, just select Simulated Adjudicator. Then I would select the servicing location. In our case, there's only one location. But if you are a multi-location banner chain, you would have more than one location here. And then I would select the servicing provider. If you are working alone, only you would show up. But in our case, we are a multidisciplinary clinic. We have 3 professionals working here, myself being the RMT. So I'm going to choose myself. The request type is going to be a payment request, because remember, I was mentioning that if your patient doesn't know his plan, you can select predetermination. We know that our patient is covered in his plan because we asked him and he told us. But he's a brand new client, so we'll need to go and enter his information for the first time. If ever you would be a returning client, you wouldn't have to enter all the information. The information would be saved in the system. The only thing that you would need to do is to enter the first 3 letters of his first or last name and click on search to find and pre-populate the information. But since this is a new client, let's create the information. And notice how fast this goes. very basic information. So first, last name, date of birth, gender, relationship to the insurer. So it's an insured member, but it could be spouse or child. So we're going to put insured members. What's the policy number? I don't know. This is the first time I'm doing this. I don't know what the policy number. I would just click on the interrogation icon, and then a card from the insurance company would pop up. And if it would be this is an example, this is Great-West Life, but if it would be a Manulife or a Sun Life, that's the card that would show up. So we literally tell you what's the number we're looking for. So I'm going to enter the information right here. So I know this is not a secondary coverage, so I'm going to click no for now. Additional information. So to who this needs to be paid to. So the insurance company wants to know who it's going to pay. Is it you as a healthcare professional, or is it going to be your patient? What's the advantage to do an eClaim if you're going to have this paid to your patient and your patient will pay the entirety to you right away? Well, the advantage is that your patient won't have to do it when he gets home. It's already been processed for him. But what we want to do is really have the full value of eClaim and just charge the out-of-pocket difference. And therefore, I'm going to select myself as being paid to. Is this an injury caused by an accident? You could click yes or no, select the type of accident, and the date. We're not looking for more information than that. But I know it's a no, so I'm going to click that. Was this service prescribed or a referral? If I would click yes, I would select only option that I have is physician, first name, and last name. Again, we are not looking for more information than that. But this is not a prescribed service. I'm going to select no. Then it's time to enter the information of the service that I rendered today. So I would enter the date of today and the service code. Well, I do not know what the service code are by heart. So you can click on the lookup icon. And you would notice that all the service code that are there are the service code that, as a professional, in my case, an RMT, would be allowed to render. So I'm going to select a treatment intervention, which is description is massage using external manual technique. So I'll just click on that, and it's going to pre-populate the information. How many of those have I rendered? Well, I rendered only one. And how long did it last? Duration? Well, 60 minutes. How much did it cost? Right, the information is the box is empty-ended, so I enter that information right there. So for me, my fee for 60 minutes is $85. If ever you are another professional, you can the service code would be codes that you are allowed to do as a professional. And as an example, if I would be an optometrist, I would certainly not be able to select a massage. If you rendered another service in the same day, let's say this is a first-time appointment and the client was new, so I needed to enter the information. So I'm going to go here and just select initial visit assessment. So this is the first time, so to enter his information. And I will select one. I'll put just 5 minutes here, and I would just put $5. So that the insurer would know the information. Now it's time to enter the information of the service that I rendered. So as you can see, I already pre-populated it, but I would select the date. The service code, I enter it here. But if you were to know what the service code is, you can click on the icon and just select it based on the description of what service you rendered. So in that case, it was a massage, being an RMT myself. I did one, it lasted 60 minutes, and I'm charging $85. At this moment, if you wish, you can save it for later. If you know today is going to be a busy day with very limited time between your clients, you save it for later, and then you can go into the history of the claims that have been saved for the day. And when your client facing, you would just select that claim and submit it, and that takes about 5 seconds. In our case, I'm going to click Continue. And the last step is to review the claim. So you can see all the information of today of the claim that I have entered. I'd make sure the amount are correct. I would read and accept the term of condition, and then I would click on Submit. Once you click on Submit, you would get an EOB, or what we call an explanation of benefits. So an EOB will confirm that claim has been accepted. Just review the details and keep it. You can save it as a PDF. In our case here, I submit the claim for $85, and I notice that my client is eligible for $74, meaning that I need to charge out of pocket to my client $11. If you need help, you can consult our resource page, which you can see on screen right now. In our resource page, you would find training video, insurance payments guide, payment reconciliation tip, fax, and your insurer's kit toolkits, which are available on our portal, but they're also available on our website right now. Mary Claire, you want to take it from here?
Thank you, Michelle. So as Michelle mentioned in the intro to this presentation, eClaims can really help differentiate you and your clinic from others. So when you sign up for eClaims, you're automatically added to our consumer search tool so that potential clients can find you when they're searching for a healthcare professional. This tool is promoted on many different insurer websites, and it was used 40,000 times last year. So there's about 100 searches done on it daily. And again, once you sign up for eClaims, you're added to this, so it gives you added visibility. We also help you with many tools to help you promote that you offer eClaims directly to your clients and to your prospective clients. So when you sign up, we send you a printed toolkit automatically to your clinic that you can use to promote eClaims. And that includes the sticker that you're seeing on the screen that you can put in your window or your door. And it includes a promotional tent card that you can put on your reception desk. We also offer a lot of digital tools that you can go and download and use at your discretion. So at the website address that you see at the bottom of the screen. And those include a slideshow for a waiting room TV screen, images for social media, images for your website. So really depending on the type of channels that you use, you can just go and download those tools and use them. We also offer some extra printed tools that you can order for a small cost if you like, all optional. So those are the marketing support materials that we offer when you sign up. And now just to do a quick recap before we finish off, I'll pass it back to Michelle.
Thank you, Mary Claire. So quick recap in 7 points. So the system is secure, and as we mentioned, we adhere to the PIPEDA Act. It's totally free to register and use. It's user-friendly, as you saw in the demo. We provide free marketing that has been approved by TELUS. You get real-time responses and fast direct deposits. Increased repeat of appointment due to out-of-pocket difference costs not covered in the insurance plan, so very lower fee to cover by the patient. And for you as an entrepreneur, on top, reduction of credit card fees. If you have any question, please don't hesitate to visit our website. You can also register here. This is the exact same link as when we showed you before we just did the demo. So you can verify if you are eligible and participate into the eClaim program. On this, I want to thank Mary Claire and hope we're going to see you on the eClaim site.
Thank you for joining us today, and we hope that you found this presentation to be useful for you. Have a great day.